Yes, I think through using iplanit and the focus on specifically the service user in terms of person-centred, we've always been a person-centred service delivery here, but having iplanit, that really drives it home more, because you're very much focused on outcomes. You're not just doing things for the sake of doing things, you're actually doing them for the sake of trying to achieve an outcome for the service users. So that is really found beneficial. I'm Clive Evans, the CEO of the Croft Community in Bangor, Northern Ireland. I mean, working with iplanit as an organisation has actually been very positive. Positive from a perspective of working with them as a team, but they also would connect me with other organisations that have implemented iplanit so I can get the learnings from them as well. So that's been very beneficial. There were a number of problems that we wanted to overcome when we were looking for an IT solution. And I looked at many within the industry, and I have an IT background, and so I was quite inquisitive as to what was out there. And the bottom line is I identified iplanit as the most simple yet usable solution for our staff and in time our service users. What we were trying to achieve by implementing something like iplanit was a number of different things. One, to address how we have accurate and readable care and support plans, because yes, we have, and that seems like a very simple objective, but it's a crucial objective because my handwriting is terrible. So if you're actually trying to read care plans, whether with the families or with the service user or with the professional practitioners, it was quite difficult. By having iplanit, we're able to have the care plans documented clearly, typed out, and also easily to change and update. So that's one example of why we would have used iplanit. Other reasons why we would use iplanit was to ensure that tasks were being identified that needed to be put in place to support the service users, as well as making sure that those tasks weren't missed, and that's crucial again, making sure that a medical appointment wasn't missed. Or, on the other hand, making sure a personal birthday celebration of a service user for their parent or their loved one wasn't missed. All very important activities on behalf of the service user. Another benefit for iplanit solution would be things like making sure outcomes were being identified and making sure that all the activities that we were putting in place to achieve those outcomes were being recorded. Not just for the benefit of the service user, which is crucial, but also making sure that you could demonstrate to the commissioning bodies when they come into you that you actually got clearly identified outcomes in place and that what activities you're taking to achieve those. Yes, actually looking at the whole IT solution that we want to put in place, and specifically looking at iplanit, it helped us rethink about some of the processes, some of the templates that we were using, so that we could actually not just implement an IT solution, but actually improve the processes as part of that. Working with iplanit, one of the key things for us was to bear in mind that we already had specific care plans in place, and being able to work with iplanit to identify how they could incorporate our thinking into the plans that they had. What was very beneficial to do was to get their learning from what they have achieved from other organisations, because obviously iplanit is working with many organisations, therefore they can bring in their learnings which we can then get the advantage of. So yes, that was crucial, being able to put plans in place that supported our needs and most importantly supported the service users' needs. Yes, some of the benefits that certainly one key benefit that I found when talking with iplanit was obviously iplanit is very focused on the service user, and understandably so. However, when you have staff supporting those service users, there's a training component of the staff that have to be monitored to ensure that you have the right trained staff supporting those individuals. And the training of the staff was not incorporated initially into iplanit. But after talking with iplanit, they could see the value in incorporating the training for their staff that were going to be supporting the people, and they included that within iplanit. Yeah, I think the main reason why I picked iplanit over other systems that I looked at in detail was iplanit was very clear on its focus. It was the service users, and with the industry that they were in, a lot of our staff have not had a lot of experience using computers, so it was important for me to pick a solution that was actually going to be relatively easy to use, and I felt iplanit did that very, very well. It put relevant information on a screen but didn't overcrowd it. So that meant that staff weren't getting overwhelmed with what was being presented to them, and they were able to use it more easily and effectively. Yes, iplanit has saved us time, specifically in the area of reporting, in the area of storage, and for example, storage, you might think, okay, how's storage? But because it's all online now, and because it's I don't have to actually print off and hold off folders in a storeroom, I'm saving up a lot of time and space in those areas. In terms of reporting and recording, if our staff are now going to a meeting, before they would have been flicking back through notebooks to figure out, okay, if it was a medical review they were going to, they had to flick back to see, okay, what were all the medical notes we wrote about this person, and then have that ready to go to a meeting to meet with practitioners. Now they can just go into iplanit, pick through notes, specific area, i.e. medication or medical areas, and then put in their period of time that they want to report on, and have that within seconds within a report. And it makes them a lot more professional looking when they go to their meeting. I think there's going to be great benefit. So because the way iplanit does the calendar, you can sit down with the service user, you can plan their week out, what they would like to achieve, what different appointments that they have, what different outings they have, etc., etc. And you can actually develop the plan with them. A lot of our folk can't read, but you can do it in picture format. So they're still involved, yet you're formulating their plan for the next week or weeks ahead.
Yeah.
So there will be that advantage over time. One of the key benefits for the managers of the different services being able to go into iplanit and on a number of different aspects being able to check to see on their dashboard have there been any particular issues they should be aware of, where historically you would think, how would they get line of sight of that? They'd have to go into each of the houses, visit them physically, check the notebooks or talk to people, where they can do it at the comfort of their office, wherever that location might be, go into the dashboard and check to see, is there any particular things going on that they need to be aware of? And that then can help them to determine what additional training might be needed for a particular house, if there's particular issues going on, if there's a particular achievement being met, to ensure that they celebrate that achievement, etc., etc. There's a lot of benefits from that perspective. Another benefit for the managers using iplanit would be in relation to the outcomes. Making sure that they can run reports to see for each of their respective areas what outcomes have been identified, are they good outcomes and beneficial for the service users, and what progress are being made against those. So that's very beneficial. So another area that's very beneficial for the use of iplanit for the managers is being able to be more in tune with what's going on in each of the locations by just looking through iplanit, so that then when they actually go to the location, staff and service users feel that they already know and are connected with what's going on, versus spending the time trying to figure out what is going on. They're actually using their time more valuable in connecting and helping in the situation maybe that's going on within the house. Another area that's beneficial for the managers is in the area of tasks. So tasks can be identified, support tasks for each of the service users, and monitoring that basically there are good tasks in place but that they're actually being achieved in a timely manner, so they can run reports to establish that. Yes, iplanit has been useful in inspections. Now, the inspectors have been intrigued, I think because you're bringing IT to this industry. That in itself is intriguing. But I've been able to demonstrate to them how we're using iplanit, and they can naturally see that person-centered. Therefore, that's all goodness for them, because they can see that whatever we're doing is actually going to benefit the service users through the use of iPlanit. Yes, I think iPlanit could be used to contribute to bidding for new business, because what it can enable you to do is show, one, that you've got a very effective solution in place to ensure that you're delivering a person-centered service. That's from the very basics of making sure there's a very robust care and support plan, to ensuring tasks have been identified to support the folks, as well as making sure good outcomes have been identified to deliver those outcomes for the benefit of the people that you're serving. So being able to demonstrate that to a commissioning body that's looking for a new provider, that would certainly give confidence in terms of how you're going to deliver the service. Yes, one of the other functions within iPlanit is the media section, and we're getting a number of different benefits in that area. One, from a service user perspective, for them to be able to, if they're on holidays, to be able to capture pictures within that, and the objective then will be able to share that to their broader family or other service users. So there's that personal aspect to it. The other aspect to it is things like, for example, medical reports or achievements through different projects that they've been working on, to be able to store those in the media section, and so that you're building up a whole personal documentation, photos, media for the service users to be able to look and to share with others as they feel fit. I think implementing iPlanit certainly has saved money. I don't have a tangible pound amount, if you like, but it's very obvious, being able to look at reports and to be able to get access to the information that we have that we didn't have before centrally, from a management perspective, even from a support worker perspective, is very evident that that's saving time, and time is obviously money, but it has saved issues becoming greater issues, because there's been increased visibility by the use of iPlanit, where people can see information quicker and are able to respond quicker to assist in various different scenarios that have happened. And that's key. Something that's not necessarily very tangible financially, but from a service user perspective, for us to be able to respond quickly and effectively for the service user's needs is crucial. How does it contribute to making people safer? Well, first of all, it enables us to have very accurate care and support plans, but also the risk assessment component within that. That's crucial. But also being able to have, utilising the dashboard capabilities where visibility can be seen by many, where we were able to respond more effectively. So I think a combination of a number of the aspects and functions within iPlanit really assists in ensuring that we provide quality services for our service users. Yes, I think by utilising iPlanit, the transparency across the various activities of what we do is there more than ever. And that's a good thing, because it ensures that we're all holding each other accountable for what we're doing in terms of as we deliver our services. So yes, I would agree. Working with the development team within iPlanit has been a breath of fresh air compared to some other organisations. And what I mean by that is they listen to what we say in terms of what we're looking for in the industry, in terms of what we actually need on the ground, and have responded quite effectively on a number of occasions in a number of different areas. And we've been able to see that feedback that we've given implemented into the organisation's IT, and then that has actually resulted in changes within the iPlanit system that we use. So we've been able to reap those benefits. So yes, it's been very positive. The IT solution that we were going to implement, one of the key aspects of that was training for our staff. And the experience that we've been through with iPlanit has been very good, I must say. We had people on site to deliver training face-to-face through several workshops, and taking various modules at various stages. And then to complement that, over time we had brown bag sessions done through Skype calls, done through various different calls to cover different topics, which kind of reinforced some of the initial learning that was given to the staff. Yeah, I think utilising IT within this industry is going to be more critical than ever before. Solutions like iPlanit will really help us to make sure that the processes and procedures are put in place more effectively, and that we're in a position where we can achieve outcomes for the service users that are important.